Hi, I'm Hannah Johnson, and I'm the International Liaison for the Fertility Centers of Illinois in Chicago. At the Fertility Centers of Illinois, we see patients from all around the globe. Our patients come to us for third-party treatment as well as regular IVF. Patients coming to us for regular IVF, which is called autologous treatment, can use their partner's sperm as well as anonymous or known donor sperm. Our goal is ultimately to handle these patients exactly like we do our local patients. They'll do their pre-IVF workup with our home office nurses here in Chicago, coordinated with their home office nurse back home. Their IVF treatment will be coordinated by our IVF team, and their monitoring will be done back home as well. They'll come to us for their IVF procedures, including egg retrieval and transfer, and then their post-IVF and pregnancy follow-up will occur with their home office nurse back in their home country. For our international third-party patients, we have a variety of different treatment options available. We have egg donation, including fresh donor eggs, frozen donor eggs, and the utilization of a known donor. We also have options available for gestational carriers and anyone who needs to use a sperm donor, anonymous or known. We do a combination of the above treatment types. So someone might need to use an egg donor and a gestational carrier, or an egg donor and a sperm donor. We also have a great PGD or PGS program. That's our pre-implantation genetic diagnosis or pre-implantation genetic screening program. The options available for egg donation include fresh donor eggs. We have an in-house agency, and we also work with a variety of agencies in the Chicagoland area. For our fresh donor eggs, we have a one-to-one program, which means that one donor and one recipient will work together. We also have a shared program, so one donor will be shared between 2 or 3 couples. This can significantly reduce the cost. In addition, we have a partnership with the Donor Egg Bank USA, also called DEBU, for frozen donor eggs. These are previously frozen eggs that are then shipped to our center and used for your cycle. We also have the ability to use a known donor. So if you have a friend or family member that's willing to donate for you, we can utilize them. There are several things that set our program apart. Our in-house agency have donors that are pre-screened, which means they're ready to go. Many agency donors have not had their full medical pre-screening, and after a couple has chosen them, they may come to the center, have their pre-screening done, and be disqualified for things like genetic carrier status or infectious disease. All of our donors have had all of this done prior to their treatment, so when you pick your donor, we know that she's ready to go. We also have options for varying degrees of openness with donors. So that might mean that you want to have a chance to meet your donor face-to-face, maybe Skype with your donor, or have the option for your child to contact the donor when they're 18 or older. Our PGD-PGS program covers the gamut of genetic testing. In this program, we test the embryos before pregnancy to see if there are abnormal chromosomes or genetic mutations. The most common error in embryos is called aneuploidy. This means that there are either too many or too few chromosomes. This can lead to failed pregnancy, miscarriage, and termination of pregnancy. By screening the embryos with PGD or PGS prior to the embryo transfer, these risks are reduced. PGS is particularly useful for women who are 35 years or older because their eggs are at an increased risk for chromosome errors. With advanced PGS, a few of the cells are biopsied or removed from a day 5 or day 6 embryo, which is called a blastocyst. These cells are then evaluated for all 23 pairs of chromosomes. We can then only select the normal embryos for transfer to the patient to increase their pregnancy chances. So if you're interested in treatment here in Chicago, there are several steps to take. Step 1 is the initial contact. You'll contact the international liaison, me, via phone, email, or Skype. I'll go over all of our treatment options, financial options, and answer any of the questions that you have. I'll then gather your new patient materials and schedule an initial consult with the physician. Step 2 is that physician consult. Your initial consult with the physician can be either phone or Skype, or if you'd like to come to Chicago and have an in-person consult, that's available as well. This is a complimentary consultation. The doctor will review your medical history and develop a treatment plan with you. Afterwards, you'll connect with your nurse for all of your pre-screening requirements. Step 3 is your pre-screening. You'll have any of your necessary tested completed at your home clinic. You'll then come to Chicago for any remaining pre-screening, a sperm freeze for your partner if you're using your partner's sperm, and consults with legal, psych, your doctor, as well as a nurse. Step 4 is your actual treatment cycle. The great thing about working with us here in Chicago is that we have a close relationship with your home clinic, so you can start your medications and monitor throughout your cycle back home. Near the end of your cycle, you'll come to Chicago for your egg retrieval if you're using a gestational carrier, or your embryo transfer if you're using an egg donor. It's during this time that your PGD or PGS will be performed if you choose to have that for your treatment cycle. Step 5, pregnancy outcome. You'll have your pregnancy test at home 10 to 14 days after your embryo transfer. After your first test, you'll have a couple more blood tests to confirm the pregnancy is continuing healthily, and then afterwards you'll move on to OB ultrasounds. We have many different patient services that are available for our patients coming from abroad. We coordinate all of your medical treatments with your local physician. We have a very minimal travel requirement. Most of our patients only have to come to Chicago 2 times, and some of them only 1 time. A concierge service is also available to assist you with your travel and accommodation needs. So our concierge will help you set up your flights, arrange a car service to pick you up at the airport, and help you get to the hotel. We have a team of experienced professionals to help you obtain all the necessary legal advice that you need. We also have several unique financing programs. We are an internationally recognized program of excellence. Part of the patient services team is to provide the complimentary car service. So this is going to get you from the airport to your hotel, as well as from your hotel to all of your procedures. We can also give you a variety of hotel recommendations in the Chicagoland area. And in addition to that, we take a photo of your embryo from the microscope on the day of your embryo transfer for you to take home. You'll have personalized communication via email, photos, and videos regarding your treatment throughout the entire process. We have several financial options available for our patients coming from abroad, the most popular of which is our Guaranteed IVF program. This program offers a refund if no live baby is born. What it includes is 6 fresh donor IVF cycles, as well as unlimited frozen embryo transfers. So a patient will start with a fresh donor IVF cycle. If they're not pregnant and they have any frozen embryos left, we'll move on to using those frozen embryos. If there's no pregnancy after those cycles, you'll move on to the next fresh cycle. If at any time you want to withdraw, or there's no live baby after all of these cycles, you receive a refund. You can utilize an in-house or an agency donor. This program is available for our 1-to-1 program, as well as the shared 1-to-2 and 1-to-3 programs. In addition, donor medications are included in these cycles. We also have a similar program available for our frozen donor eggs. In addition, if you'd like to pay per cycle, that's available as well. We really look forward to working with you here at the Fertility Centers of Illinois in Chicago. Thanks for watching.